Good afternoon. My name is Dr. Stephen Blount, and I'm here at the Advanced Medical Solutions to give a testimony, I guess, about my experiences here and why I came. Hurt my back in the Air Force, and they wanted to take a few discs out of my back, and so I went to a chiropractor, and he said, "Give me 3 weeks to work with you, and I'll keep you out of surgery." And that happened. So I became a doctor by accident. Years went by, and my knees started to suffer from many reasons. I think the imbalance because of the polio, but I was accosted one time in Panama and had to do a little this, but my knees took it. And after a while, knees were complaining, so I went to the VA, and they decided that I need knee replacement surgery. And I swallowed deeply, and I go, well, I know what that's like, because I had several patients that have gone through it. I've seen it before and after, and then after another one. And I met Dr. Scott at one of the dinners. I was invited to a dinner with my wife, and he gave a great explanation of how they do this work. And I asked a lot of questions, and so did my wife, and he had answers. I liked that, so I said, okay, let's come in here and see what's going on. So I went with it. So that was 3 months ago. 2 months after the injections, in both knees, my left knee completely not a concern anymore. No pain, no range of motion deficits, nothing. The left knee is like, oh, brand new, nothing going on. The right leg, this was the one that they said osteoarthritis and all kinds of other things, and this and that, and torn meniscus, a few other things. Well, guess what? After 2 months, 50% decrease in pain, 60% increase in range of motion. They did the testing here before, and they did it after. This is what I used to do for Texas, so I know they did it right. They used the right instrumentation. The interpretation was correct. People who work here, they have their degrees, they understand what they're talking about. These people know what the hell they're talking about, right? And the big thing for me is, and I'm a patient, so how would you say, I'm anxious. I want to get better right now. Well, it didn't happen overnight. So I have to be reasonable about the time it takes for my body to readjust and to rebuild tissue. I have to be in balance. So the first thing that you understand is they do a full workup on you here. They want to find out what you're lacking in certain ways. It could be diet, exercise, all kinds of things. They want to ask the aspect of your life so they can come up with a program for you. I like that. It's not one size fits all. That's just not fair. So we talked about it. I've gone through rehab. Chiropractic is very simple. This process is very simple. But I can tell you now, it's been 3 months now, and I'm waiting for my next evaluation. I can walk like I used to walk. And I like to walk with pep in my step.